At UT Southwestern, we have a dedicated group of highly specialized physicians that see hundreds of patients with kidney cancer. These are individuals that have developed expertise in this cancer type that is not a common cancer type.
While having an X-ray, we discovered a spot on my kidney. You know, I trust doctors, but at this point in life, I have to think about it and process it before I'm going to do anything.
Brenda was given few options and may have felt somewhat rushed into trying to make a decision. She came to Southwestern, where we were able to review with her the information provided to her already. Given the small tumor she had, there was no rush. We could watch and see what it did.
They only wanted to watch it to see if it was going to grow. It gave me time to think of my options and think of what would be best for me.
About 30% of these small, less than 2.5 centimeter tumors actually never grow. When they do grow, they grow usually 3 to 4 millimeters a year. So if it's 2 centimeters, for example, it will take over 5 years and it's still stage 1, and that has an excellent prognosis.
The traditional monitoring program that we employ here includes abdominal imaging, either with a sonogram, CAT scan, or an MRI every 6 months. What we look for is change in the size of the kidney tumor or the change in the way that it looks.
We can really tell a lot about what's going on inside the tumor. I will provide information to the urologist if we think that it's a malignant tumor about how invasive the tumor is.
We think we can develop new ways to image cancer. What we're doing is to very carefully study the metabolism of renal tumors at different stages of their growth and to correlate metabolic activities with imaging features. Then you wouldn't even need tissue. You could just simply have the patient come into the MRI suite and image the tumor non-invasively to predict whether that patient's tumor is going to be aggressive and go on and metastasize, or whether it's going to stay in the same place, in which case we can watch it with minimal intervention of the patient.
Waiting and watching on the patient's part does take trust, and some still want to have it treated, understandably so. And that's not wrong, but what we're trying to do is balance all risks. She's an example of someone who watched it with my advice, then has decided with growth to now treat the tumor.
I would hope that the person that has a tumor the size of mine realize that they can stop and come to grips with it and have a peace about it and seek that doctor that best fits them. We felt that the doctors here at Southwestern were the best for us.